In modern medicine, there are three important treatment methods for coronary artery disease. That is heart disease caused by blockages in the heart's blood vessels. One is medication, two is angioplasty, and third is bypass surgery. Study shows that whether the treatment is medication or putting stents or bypass surgery, the future risk of a heart attack and death from a sudden cardiac arrest is the same. After angioplasty or bypass surgery, also lifelong medication is often needed. If it is so, why is angioplasty and bypass surgery done in spite of the risk involved and the side effects that may result? Modern study shows that the reason for fat deposits in the blood vessels and consequent blocks are the anomalies in the lifestyle and lifestyle diseases like diabetes, hypertension, obesity, dyslipidemia, etc. Let us see how by correcting lifestyle it is possible to not only reverse but also reduce and stop medication for hypertension, diabetes, dyslipidemia, excessive cholesterol, obesity, and also avoid the need for angiography, angioplasty, bypass surgery, pacemaker implant, etc. Health tips are not the focus here. Rather, the effort is on providing information that will help you to understand the causative factors behind this disease, measures for early detection, investigation to assess the impact of disease on different parts of the body, available treatment options in modern medicine with their benefits and limitations. The goal is to help you understand the relationship between the disease and the lifestyle factors. More importantly, to understand the impact of lifestyle correction on reversing the disease process and preventing recurrence. Those who are on medication should remember to reduce or stop medicines only under medical supervision. When we try to understand the treatment and the pros and cons of treatment aspects for this coronary artery block and heart disease, first we should have an understanding about the heart itself and its blood circulation and nerve supply, etc. This heart, we all know that it is a muscular organ. It is pumping the blood to all the parts of the body, and this heart also itself has to get the blood circulation. That is coronary, through the coronary artery, heart is getting the blood when the heart is beating. There is a right coronary artery and left coronary artery. The right heart is mainly, the right side of the heart is supplying to the pulmonary circulation, that is to the lungs, to oxygenate, get it oxygenated, and left heart is receiving the oxygenated blood and pumping it to all the organs of the body. So, and also the heart, this pumping system has to work. For that there is an electrical activity is going on, and this heart, for this pumping system to work place, there is a small brain itself in the heart actually. That is called this, when we artificially insert it, it is called pacemaker. That is that there is the electrical activities for this pumping or the beating of the heart is originating in the SA node, that is on the right side of the heart, that is the atrium, and it is spreading to AV node and this bundle branch, that is the nerves which is going into the bundle branch or Purkinje fibers and all is the name in the medically when we talk about it. And that is actually, we are measuring or looking into the ECG is actually this electrical activity taking place inside the heart. If there is a problem with this nerves or the muscles, it will reflect on the ECG. Next is, what is the root cause for this heart block or the why this coronary artery is getting blocked? What is creating this block? Actually, it is fat deposits. It is actually, when we think about the blood vessels, it is not only the coronary artery, we have almost 60,000 miles long blood vessels actually, this arteries and veins, it collectively it is around 60,000 miles or 1 lakh kilometers length is there. Comparatively, it's a this coronary artery is a small part of it. The fat deposits are not only depositing. If the coronary artery is getting blocked, the whole body, all the 60,000 kilometers of the blood vessels can also be getting affected. That is actually, fat is getting deposited inside this lining of the arteries. Why? It is starting with the dyslipidemia, that is the blood itself is having excess fat, that is cholesterol and triglyceride. So when this cholesterol and triglyceride is increased, that it is getting deposited in the arteries, and there is the inflammation of the arteries, that is called arteriosclerosis. And this particular deposition and getting this small hills inside this, we can say, when it is saying small bulges or hills inside these arteries, and that is called atherosclerosis. When this when if it is inflammation is there, it will get calcified also. So the calcification of the vessels will make the vessels more rigid, and so if it is dilatable, only the pressure will be maintained. If the blood vessels become rigid because of this calcification and the this fat deposits, the pressure will increase. The heart has to, because the blood vessels are getting narrowed, the heart has to put more pressure for making the blood reach the organs. Actually, the tension, hypertension, actually this hypertension is the measure of the blood exerting on the arteries, arterial walls actually. So this excess fat in the blood, how excess fat in the blood is happening actually, you should understand. If you eat more fatty things like nuts or cooking oil, more of rice things, or even carbohydrate. If the carbohydrate is an excess quantity, it will be converted into fat and deposited in the body. That is obesity. Actually, this heart problem starts with obesity, then dyslipidemia, the cholesterol and triglycerides is increasing, then hypertension, and most probably parallelly there will be diabetes also, and many of the patients there will be thyroid problems also start, the hormonal imbalance also will start, and hyperinsulinemia. Not only diabetes means it is not only glucose is increasing in most of the type 2 diabetes. Actually 90% of the diabetes is 90 to 95% is type 2 diabetes. In that there is no insulin deficiency. There is actually many of them, the high insulin will be insulin quantity will be higher than the normal. So this is also creating problem. Actually, when the insulin level is high, there is immune system is not be able to function properly, and there is sodium retention, so the pressure also will increase. That is why when we start, most of the patients, when they start with initially obesity, then diabetes, when we start with if the hypertension is not started earlier, when we start the medication, you will get the hypertension also, because most of the medicines which is taken for the diabetes is either insulin or the tablet. Insulin is directly increasing the insulin quantity or hyperinsulinemia, and most of the medicines are actually promoting the pancreas to produce and release more insulin. So the insulin level will be increasing. That is one of the reasons for this metabolic dysfunction and heart block, this fat deposit also. When we come to the symptoms, what is the symptom of a block in the coronary arteries? The first symptom will be, they may be feeling tired, or they may feel dyspneic, exertional dyspnea. When you climbing the stairs, previously you may be able to climb 4 or 5 stairs. Floors you are able to climb, but when you climb 1 or 2 floors itself, you feel dyspneic, or increasing the heartbeat, or the heartbeat becomes irregular, and that is called as, and if it is, that may be the initial symptom, then you may start a heaviness or pain itself when you are exerting. That is called a stable angina. When you are doing exercise or some physical activity, you get a chest pain. When you take rest, or you put if you have already seen a cardiologist and they have given some tablets to put under your sublingual tablets, then you get relief. So that is called the stable angina. The heart is not able to work and heart feels as oxygen is insufficient, then you get the feeling. Next is unstable angina. It is more dangerous, and you feel pain you cannot predict the pain, and you usually after when you get stressed, that is all because of the hormonal changes or the cardiac need is increasing actually, or after taking food. Many will not be able to when they after taking the food, or when you are taking even their routine activities like taking a bath, or even there are patients who are complaining with the defecation. If they strain for the defecation, they get the chest pain also. That is the in the extreme case of angina actually. Then what is heart attack? That is, angina is a chronic deficiency. There is no block, only there is not complete block. There is only narrowing of the blood vessel, but the flow is taking place. And in the heart attack, one of these blood vessels get completely blocked. That is why this block happens. These fat deposits are there, no? And with the pressure, the high pressure or something like that, it is or excess pressure inside this accumulated fat, it ruptures. And when it ruptures and the cholesterol crystals or other fatty contents comes out, the blood will accumulate, that is platelets, that is the one which is creating clot. That is actually, it's a protective mechanism. It's a clot formation is a natural protection. If you have an external wound, the blood will come and the sealing has to take place, clot formation and sealing. Just like if you have an internal bleeding also, it has to take place, the sealing of the damaged blood vessel has to take place. So just like that, when there is an abrasion in the blood vessel itself also, the blood is flowing inside, they will go and seal it. So a clot is formed, but it is a narrow blood vessel, already narrowed, and there is no space for the clot, and it will block, and you get a sudden heart attack. Because a major part of you get a major part of the blood vessel, heart muscle is affected, you feel the pain, and you can get an attack. And if it is affecting big vessels, especially on the right side, you can go into a sudden cardiac arrest also. In that case, you are giving CPR and all. Another type of heart attack is silent attacks. That is usually happens in a diabetic patient. Diabetic patient, the pain sensation in the leg and feet and all is reduced now because of the neuropathy. The same thing happens with the cardiac nerves also, and also the autonomic nerve system also can be get affected. If the autonomic nerve system, that is get affected, even the heart irregularity can also occur. The heartbeat irregularity can also occur if there is a nerve system is damaged, internal Purkinje fibers or the bundle branch, or if it is affected also, the irregularity can occur. And if the multiple small attacks, especially in the diabetic patient, or this with the block itself, it can lead to cardiac failure. That is, the heart is not able to pump properly. This is why we will be having only 40% pumping or 30% pumping or only 20% pumping. The pumping is reduced. That is the usual term doctors are telling to the patients. So that is because of the chronic muscle damage actually. It can also occur with a sudden attack, which is that is a major blood vessel is affected. Then part of the cardiac muscle is damaged, and after that major attack also it can occur, or with a silent attack gradually the cardiac failure can occur. Next is why these blood vessels are getting damaged. What is the pathology behind? Basically, the latest study shows that the excess fat, excess glucose, anything is excess is body takes it as a toxin. And this excess fat and glucose which is creating damage to the blood vessels, because they're flowing always into the through the blood only. So blood vessels are getting damaged because of their presence itself. And when they are getting damaged, the inflammation starts. The inflammatory changes because of this continuous contact with this excess fat and the sugar, the atherosclerosis or the damage, the arteriosclerosis comes, and along with that, the excess fat is deposited. When there is abrasions in the blood vessels, especially that is very common with the hypertension, when the pressure is also there, and the fat deposits will start accumulating. That is called atherosclerosis. That is more this hills and or the bulges inside the blood vessel. Another reason is excess amino acids. That is, we all know that we need protein. But if you are eating excess carbohydrate and fat, or especially carbohydrate, for the carbohydrate metabolism, this vitamin B6, B12 and folic acid is needed. If it is not sufficient and if you are taking enough for excess protein also, the homocysteine, another one of the amino acids, its metabolism will be get blocked. So the homocysteine will accumulate in the blood. That is an amino acid. And actually it acts as a corrosive to the blood vessels. It can damage not only the artery, the vein also. This cholesterol, this blood glucose and the homocysteine, if it is increased, it is not only damaging the artery, but we are always more conscious about the arteries, but it is damaging the this veins also. So the nutritional deficiency can damage this, and also the toxins, even this all the color preservatives and all the pesticides, all may be making damages. We don't know exactly which is actually how much it is damaging and all, we don't know, but definitely we can assume that that also will be creating damage to the blood vessels. Then infections. This we know that with the COVID, after COVID infection, so much of heart attacks were coming even after the vaccination, because of the presence that also, that it may not be vaccination, it may not be this COVID virus or the protein itself. The preservatives and used for this stabilizing agents and which is used for this vaccine also may be creating that, maybe the one of the reason for increased heart attacks and the cardiac events after the COVID. And it can happen not only for the COVID, because we become conscious because of so many patients and so much of infection, we are very consciously following it, we don't know that. But otherwise also after the viral infection or even the bacterial infection, especially those who with the caries of the tooth or the chronic tonsillitis, in such patients this bacteria can get into the blood vessels and it will produce inflammation, and it can go into this bacteria. Once it get into the bloodstream, it will go into the coronary artery also. It can create inflammation there. It can launch in the cardiac chambers itself and create problems. So that is one of the inflammation created by these infections also can be a problem for the coronary heart disease. When we think about the cardiac problems, there are two types of problems. One is a plumbing problem, that is with the blood vessels. Another thing is electrical problem, that is about the electrical wiring system. So if there is a block, that is because of the plumbing problems, and we try to avoid with the stent and bypass and all. And if it is a nervous damage, because of the blood vessels is getting damaged, the nerves can get damaged, and then the irregular heartbeats comes. Cardiac irregularities like atrial fibrillation, atrial flutter or ventricular tachycardia, and so many different medical terms are there. But basically it is irregularity, and the extreme form is cardiac arrest. That is the heart, the electrical activity stop for a while. That is can be the major cardiac block of the heart, especially involving the right heart, where there is this SA node and AV node and the nerves of the heart itself. So in that case we have to immediately, if you are within 1 or 2-3 minutes, if you are able to give CPR and revive the patient, it will be okay. But if you are delayed revival, if you are able to revive only after 10 minutes, 15 minutes, then you may not be able, the problem is the brain will be damaged. So even if the heart is picked up, and we are giving all this bypass or immediate this cardio heart and lung machine, and doing the surgery or whatever you do, you may not be able to bring the nervous system or the brain functions to normal. Next, what are the predisposing factors, or what type of patients get this heart attack? The first is genetics itself, family history. If your father or mother is having cardiac problem, definitely you can also get it. But if you get family problem from the both sides also, you need not worry about it, because if you correct your lifestyle, you need not get the cardiac heart problem, heart attack or cardiac arrest. And also you should avoid smoking and alcohol also, and get the body weight also ideally, and avoid to get diabetes, hypertension, dyslipidemia, etc. So if you are, these are the predisposing factors, the lifestyle And the genetics. If at all you are genetically prone for the heart problems, if you lead a healthy lifestyle, you can keep the heart attack and heart problem away. Next, how do we diagnose a heart attack? What the patient should be careful. If they feel like dyspnea or chest pain, that is, everyone is most worried about the heart attack. Whether the pain which is coming at the center of the chest and referring to the left side of the heart, that is the typical cardiac pain on the shoulder or the chin, those way, or even the center, and even epigastric pain, upper part of the abdomen, that also can occur. So even if it is in the upper part of the abdomen, you may feel it is only an acidity problem. So how can you distinguish between the acidity or the heart problem? If you get the pain, we should see that if you take some antacid or this acidity medicine, if it is just because of the acidity, it will go off. But if the pain is continuing, then you should be very careful. First thing, you should take rest. If you are driving, what you should do? You should stop the vehicle and rest and call someone for the help to go to the hospital. And when you take rest, then if the pain is going, then it is okay. And if it is, when you restart again, it is reappearing, you should really take care. And don't, if you are doing some work, don't think that you will finish and then go for the help or take rest after finishing all this. The most important thing is you take rest. If you feel like chest pain and if it is this palpitation or anything, first important thing is take rest. Means you are reducing the stress of the heart or the strain of the heart. Heart is getting rested. And especially if it is possible, you lie down and take deep breath also. Deep breath means oxygenation is increasing. Give all the other part of the body rest so that the heart can take care of its own function and the basic function of the other organs. So the brain also and the heart also has to function all the time. So all the activities you stop and take rest and see what is happening. And when you come to the hospital, what is actually doctors check is the ECG, and if there is an infarct or there is a block, it is infarction is there, then there will be the ECG changes will be there. There are STEMI and non-STEMI. There's ST segment, that is actually yes. There are this ECG. Each beat is differentiated with a name, and there's the XT segment elevation. That is one of the sign of an attack. And it's called as STEMI and non-STEMI. There cannot be, some cases the ST segment elevation or the ECG change may not be there. And some cases irregular beats will be there, missing beats and all. And in that case also there can be an attack. In that you check for the troponin level. That is the immediate cardiology unit and all, check for the this thing. And if the troponin level is high, then you take it as a heart attack. And there also the most important thing is even if inside this ICU, what is the main purpose of putting the patient in the ICU? To reduce the stress, mental and physical. The physical activity is complete rest. Physical, there's only the heart has to take care of the heart and the basic function of the brain and other systems. And then is the emotional rest also is very, very important. We all know that a heart attack can come with an emotional stress also. So take rest physically and emotionally. Then if you don't have much of the problem and your pain is gone, then next what? Then is the echocardiography, the cardiac function, what is the problem? And also the other blood test, like so many parameters, cardiac markers are there. Next is early diagnosis if at all there is a heart attack, if you have symptoms of exertional dyspnea and all, then how to diagnose? You only have, you feel that if you are climbing hills, you are becoming more fatigued early. Especially the ladies may not feel this pain, chest pain and all. They may feel that tiredness only, or some palpitation. The others also, many, especially those obese patients, they may not feel that pain, only this dyspnea and this palpitation. In such cases, how can you diagnose what is the stage of your heart? The blood test itself can give a very clear idea. That is one you can definitely call troponin I. Troponin I and T is immediate heart attack effect. You can or both together they can. The troponin I is specific for this chronic problems actually. The risk of heart attack, what is it? What is your risk? You can assess with the troponin I. And this other cardiac markers like HSCRP, blood lipids, that is if cholesterol level. If you are taking this statin, the cholesterol level will not give much benefit because it is already blocked. The cholesterol synthesis is blocked by using statin. So cholesterol, if it is normal also, doesn't mean that your heart is okay or the chance is reduced. But the triglyceride level is normal and HDL level is okay, you can be relaxed. But if the HDL is low and the triglyceride is high, definitely it is a risk factor. Then homocysteine level, that is another cardiac marker. And there is plaque test, that is actually an enzymatic level inside the plaque actually. And ApoB lipoprotein, that is if it is increasing, there is a chance for increased attack. And next we can, that is on the blood level. Next is echo in the scanning, that is ultrasound scanning. That is a safe method of checking into your heart and looking into the doctor is not really able to look into your heart. That is the pumping and everything you can check with an echocardiography. And then CIMT, that is another ultrasound scanning, Doppler and ultrasound scanning of the neck vessels. This is carotid artery. Coronary artery is supplying the heart. This carotid artery is giving pumping or taking the blood to the brain. The damages or the atherosclerosis changes can be seen in the carotid artery. And even those who the risk of the stroke is also high if there is a atherosclerosis of the carotid arteries. So, and also this is big artery and it is just subcutaneous. So you can get a clear what is the carotid intima-media thickness, what is how much fat is depositing under the arterial lining. And also you can assess the water aging also. It is available, it is a simple test, but it is not utilized in the proper way. I haven't seen many of the cardiologists asking for it. But for the clinically supported lifestyle correction, we are doing it in the initial stage. And also the progress, the atherosclerosis, reduction in the atherosclerosis also assessed by doing CMT because it is very simple and no side effect, no radiation, and low cost also. But other things like CT angiogram, MR angiogram, it's all costly and also it's all radiation is there and also the traces, even this traces has to be, the medication has to be injected before the, for clear vision or the clear understanding. I had to put some medicine also before you do the angiogram, this MR angio and CT angiogram, etc. And even then now latest the PET angiogram also is there. There also traces is used, that is radioactive traces is used. Next is percutaneous catheterization and angiogram. That is with the artery you are entering the cardiologist, this invasive cardiologist, interventional, not invasive. The interventional cardiologist is entering your artery and taking it to the aorta and injecting dye into the coronary artery. But it is the most invasive and it itself can produce side effect and even the catheter and all, it can even, if it is going into a narrow arteries and the atherosclerosis will be there, no? So there can be an injury or abrasions on these plaques itself and the accumulation of the clot formation and the stroke. Possibilities are there, but luckily only very few cases such accidents is happening. But another major important side effect of this invasive percutaneous, there is a common thing which is done in a cardiac unit actually. When you get a heart chest pain or if you see the stress mill test, another thing is this TMT test, that is induced stress, the exertion or the physical with what is the condition of the physical activity, how your heart is working. In that also, generally in the cardiology unit they ask for this angiogram, and if they see a block, definitely there will be block. If you have 90% of the patients, if you do an angiogram, especially after 40 years, and when you have a exertional dyspnea, there will be block will be there, and then they put the stent also along with it. That is primary after heart attack or the chest pain, if you go, generally the cardiologists call it as a primary angioplasty. Immediately put the stent. That is the norm in most of the hospitals actually follow. And if you are not able to put the stent, then because of the calcification, the blood vessel is not yielding to allowing you to insert the stent. That is actually a metal steel piece, which is steel mesh actually of 1.5 to 2.5 centimeters long generally, and it is inserted and pushing it will, when it is inserted, it will push the fat to the side to the blood vessel, so temporarily it will be opened. But there is a chance for reclosing, even this clot formation on this foreign body. That is the major risk for this inserting the stent. That is why you have to take immediately after the stent, may be coated stent with anticoagulants and all will be there. But even though you have to take it 2 or 3 tablets plus anti-acidity tablet, because this blood thinners is very acidity and ulcerogenic inside the stomach, you may not be able to tolerate. So then one proton pump inhibitors, the anti-acidity medicine also. Altogether 3 or 4 tablets you have to take for another 1 year. That is the problem with the stent insertion. And angiogram. You are injecting a dye, it can damage your kidney also. So before doing such surgeries, you have to check for the condition of the kidney also. It is, if you are willing for a lifestyle correction, you do not go for this. Stabilize the patient, because whatever procedures is done on the heart, especially in an emergency situation, it's a risk. There is a risk because your heart is already weak and your cardiovascular system is already weak, and you are putting stent and catheters and inside. It's a problem actually. So you should definitely rethink, think twice before giving consent for this angiogram and angioplasty. As even if in an emergency situation, if you should definitely get admitted in the ICU, and always ask for your preferred method. Always ask the doctors to stabilize you, and then you can relax and do the other test, and then decide on whether you want to go for a angioplasty or a lifestyle correction or angio bypass, etc. So immediately within the pain situation, it is always better take rest and get the rest inside an ICU itself, cardio unit. Then about the irregular heartbeats and all, this ECG monitoring, continuous ECG monitoring, heart monitor, or even implantable loop recorder. So many things are available now, and also electrophysiology studies. So you can do such studies and continuous monitoring, and even now there is a special watch available which can be connected in the computer to the mobile also, and even you get a warning your heart is getting irregular, and in such cases also you can go see what is it. But you should not rush into the decision of doing inserting a pacemaker or going for the active surgery, electrophysiology also. That is another for the irregular heartbeat. There also you are actually cauterizing the cardiac muscles, especially electrical activity area, or the cardiac nerves, they are blocking or cauterizing. Actually, it is all these procedures are damaging. So ideally, you should rebuild or you should repair your problematic area. And especially this engage the blood vessels, arteries, and the nerves of the heart. Next is how you can see the cardiac failure. I have to assess. There is one is echocardiogram. It will give an assessment of how it is the pumping level and all. We will be able to know. And also the BNP. That is another ANB and BNP, and two hormones are there. That is actually some sort of hormones from the brain and also from the heart itself, and that level will be increased with the heart failure. That is, and also this basically echocardiogram and BNB and ANB test will give an idea about the cardiac situation. Next, what are the treatments? Basically, there is no medicine to clear the block. Till now, there is no medicine for the clearing the block or the fat deposit from the blood vessel. Recently, some suction, this intravascular suction and so things are developing, but it is not at assessed or not in the regular treatment modality. The medication which is given is beta blockers that is to reduce the heart rate, and also vasodilators like calcium channel blockers and this nitroglycerin sort of sorbitol. That is what you are applying in the mouth when you get a pain. And next is statins actually. That is to reduce the cholesterol level. Actually, it will not much effect on the triglyceride. Actually, more problematic is triglyceride actually. But the cholesterol is produced by the body. If you have a hormonal deficiency or if you want vitamin D deficiency, your cholesterol level will go high because cholesterol is needed for the synthesis of these hormones and the vitamin D, etc. So you are creating an artificial reduction in the cholesterol synthesis will not be much of value, provided if the triglyceride also is not normal. Then the medication is for the BP. For the BP there will be so many medicines are available, and 1 or 3, usually we have seen for 4 or 5 BP medicines itself, even though it's your BP may be high also. The BP may not be under control, and diabetic medications to control the diabetes. And if you the insulin and 2 or 3 diabetic medicines also, your sugar may not be under control. There is a problem with many of these heart patients. And next is the blood thinners. That is aspirin, clopidogrel, Prilitan, so many things are there. And that is to prevent, because your heart is having these cholesterol deposits, and if it is breaks out and come out, the clot may be formed there. So you are as a preventive, you are taking blood thinner. There is not, currently there is no problem, but you are thinking that there can. But the body will bypass all this mechanism generally. That is why you are not getting bleeding. So that is also not really a solution for heart disease. Then if you, with the surgical measures is one is balloon angioplasty. That is, you are inserting a catheter into the this artery on the hand and reaching the heart and entering the coronary artery and dilating the artery. But it is a fat block. Just because you are dilated it will come back. After, immediately if there is a this thing, it will just open, but after you take it out, within no time it will, that fat will bulge out into the artery. You can just imagine, logically you can imagine. Then putting the stent, that is a metal piece is inserted, and because of its tensile strength, it will push the fat away and make the blood, allow the blood to flow. But the problem with that is it can get immediately after onwards, at least for the next 1 year, you have to take 2 or 3 tablets plus this anti-acidity medicine, maybe 3 or 4 tablets you have to take for the next 1 year. Even with the medicines, you may be having gastric problems also. That is the, if you are putting the stent. Otherwise, the blood can clot, make you clot on the stent itself and create a block. Next is bypass surgery. Bypass surgery is generally advised, and the cardiology point of view, advised when there is the blood vessel, this coronary artery is stiff and it is not pliable, and for a stent insertion because of the calcification, they will pick a artery from the, or usually vein is used for the bypass, and the harvesting the artery, actually it is the vein, and it is harvested from the leg and connected to the aorta, and the reconnected with the coronary artery below the block where it is. And also there is diversion of the internal thoracic artery, that is the artery which is supplying the blood vessels of the chest, is diverted from chest to the heart also. That is also, so 4 bypass, 3 bypass, so you are hearing, no? But this way it is achieved. The problem is here also, you are not able to correct the block or remove the fatty deposits. So the process will be continuing like that. So you will be getting more and more blocks. You cannot do bypass surgery every 3-4 months or anything. Only with the lifestyle correction, you will be able to get even that also. After bypass surgery or stent, if you don't do the lifestyle correction, you will get the attack or the problem again. So that is what is showing the studies also. So everything, the most important is the lifestyle correction. Another thing you should understand about the bypass, the stent, the dye injection and contrast nephropathy can occur. Bypass surgery is a major surgery. You are opening the central, the sternum, which is actually your ribs are inserted. So it has to be opened, and the heart is entered, and the heart lining, that is pericardium, also is opened. Then only this coronary arteries is exposed. Actually, the coronary arteries is passing over the external surface of the heart, and so you are operating on the surgery. During the surgery time, the heart-lung machine is usually used, so the blood is diverted. So the blood, when it can get clots also. That is the major problem with the bypass surgery. One is the surgery itself is a big major surgery, and you will be closing this sternal wound and all with the wires, the steel wires. So the surgical part and this foreign body, this sternum wire inside, and such problems are there. And also there may be so many comorbidities. A patient who is having need for the bypass surgery will be having diabetes, hypertension, all these things. If the diabetes, the wound healing can be affected, and so many problems. And one of the major problem, the side effect is a stroke itself, because of the even for the stent and also the bypass surgery, post or intra surgical time, this clot can occur, and if it goes to the brain, you can get a stroke also. And next is this irregular beats, or the heartbeat is going down and it's going to 40 or 45, etc. Then you can implanting a pacemaker also. That is another way of treatment. You should, before getting implanted into a pacemaker, you should remember that if you implant a pacemaker, you have to take blood thinners lifelong. So if you are not implanting, then you can come, there is a possibility of come out of all the medication. But even if with the lifestyle correction, once this pacemaker is implanted, you cannot come out of the blood thinners. You have to take it lifelong, otherwise the risk is getting a stroke. And another important side effect of accepting a pacemaker is, if you are getting an injury or need a surgery, it will be difficult, because you are on continuously, you have to be on the blood thinner. Next, what is the real solution? We have seen that this medicine, actually there is no real medicine, only this correction of the lifestyle part of it, that is also symptomatic only. You cannot have any medication for reversing the lifestyle disease like diabetes, hypertension or anything. Only the symptomatic and controlling, that is all happening. So, and also the surgery, stent or bypass surgery also not giving a cure. Then what is the real solution? Basically, the real solution is lifestyle correction. This all comes under the lifestyle diseases. And this is because of the accumulation of the lifestyle diseases of multiple factors like diabetes, hypertension, etc. So, reversing those factors is the most important. So, reverse the lifestyle disease, that is the solution. How to reverse the lifestyle disease? If it is in the early stage, when you start with the obesity or when your BP is 130/90, don't look for the medication. It's a simple solution, you go for the medicine. If you are having a diabetes, pre-diabetes itself, you start with the metformin and other medicines. So instead of that, you try to correct your lifestyle, reduce the calorie intake. See that you are taking a very nutritious food, all the nutrition in the correct quantity, and can maintain your body proportions, the body weight in the normal range, and half an hour to 1 hour exercise daily. So you can come out of this diabetes, hypertension, dyslipidemia, everything you can come out of by self. But if you have diagnosed with you are taking so much of medicines for the diabetes, 2-3 medicine, hypertension, 2-3 medicine, blood thinners, and had 1 or 2 stent put, or already had bypass. In such cases, you have to get the clinical support is needed for the attaining the lifestyle correction. Because if you are on medication, you won't be able to control your appetite, or simply if you are on many medications, you won't be able to control your food or calorie intake. So you need support. In short, one, heart disease is primarily a lifestyle disease. Second, the primary cause of fat deposits in the heart's blood vessels and subsequent block, irregular heartbeats, heart attack, and heart failure are the anomalies in the lifestyle which cause diabetes, hypertension, and excessive cholesterol and triglyceride in the blood, etc. Third, a lifestyle correction can reverse obesity, hypertension, high cholesterol, triglycerides, diabetes, etc. and also reverse atherosclerosis, heart disease, and the blocks in the coronary artery and other arteries. Fourth, for those on chronic medication for diabetes, hypertension, high cholesterol, and heart disease, and those advised for angioplasty, bypass surgery, pacemaker, etc., if they are willing to correct their lifestyle, they may be able to avoid the need for surgery and chronic medication. Clinically supported lifestyle correction can help reverse the primary condition that cause heart attack, like hypertension, high cholesterol, and triglyceride, diabetes, etc., can be controlled without the need for medication within a very relatively short period of time. Fifth, heart attack do not happen because there is a lack of medication or stent or bypass operation, but as a result of lifestyle-related deficiencies. Sixth, remember, 90% of the operation and medications needed for heart disease can be avoided if the patient is willing for lifestyle correction. Next, let us understand what is clinically supported and supervised lifestyle correction. In this, the first step is to understand your body parameters by assessing body composition, the lean mass fat mass ratio, body age, fat status, etc. Second step is to evaluate the current status of your organs like heart, blood vessels, liver, kidney, pancreas, hormones, immune system, toxins level, nutritional status, etc. and also to find out the most suitable food for your body and what to be avoided. Third step is to identify what lifestyle modulation can help achieve reversal of the disease process, attain desired body composition, and normalize blood parameters based on the patient's parameters. Effort is directed to provide optimal nutrition, physical activity, and reduction in toxin level. The focus is to create an enabling environment to balance the metabolic activities at cellular level. In most patients, even those on medication for many years or advised surgery for lifestyle diseases like diabetes, hypertension, heart disease, arthritis, autoimmune diseases, cancer, allergies, etc., can prevent progression of the disease to some extent, reverse the damage, and come out of most of the medications within a month and avoid surgeries provided the patient is able to correct lifestyle before the organs are irreversibly damaged. Next, we will see what is the result of a clinically supported lifestyle correction for a patient with heart disease. First, we will see a 50-year-old man, height 172 centimeters and weight 77 kg. And he was under medication for diabetes, hypertension, and uric acid and arthritis. This gout also was there for the last 5 years. But he's diagnosed with the heart attack, coronary arteries 1 week back only. And he was sudden heart chest pain and admitted to a hospital, taken to the hospital, and the primary angioplasty is done. That is on the first September 1st, he had the surgery, this stent insertion. And actually, while he was resting in the ICU, he looked into the options and he saw about this clinically supported lifestyle correction. And he came to me by 12th. 8th was this first was the surgery, and he came on 10th. 10/8 he came, and he is joined for the started clinically supported lifestyle correction on 12th. And before the starting, we have looked into his blood parameters. Actually, for the first, we'll see what are the medicines he was taking. He had put his 2 stents. He was put on ecosprin, that is aspirin, and ticagrelor. Okay, that is another blood thinner. It's all these names are very difficult. This is answer that is more easier than brand name. So that is twice the 3 tablets. One is once a day and the other is twice a day. And along with that, Pantos DSR, that is containing 2 domperidone and pantoprazole. That is, in fact, that also twice. So 5 tablets for that. And also Aceto, that is this atorvastatin 80 milligram, very high dose. Prolomet, that is metoprolol, beta blocker, that is BP, reducing the BP, and also this for the heart rate also. Amlong, amlodipine, and acetylcysteine and taurine, that is for the kidney protection because his kidney function was down. And fluvoxostat for the uric acid, and glimepiride and insulin and metformin. On so many medicines we are taking. His problem that time was actually he's very tired. Tiredness was the worst of this thing, and tiredness was his main problem. And his HbA1c was 7.7, and his homocysteine and many cardiac markers were very high. And this troponin level was high. Actually, after the surgery, although he was not advised to take any rest or anything, he was not. I was wondering why he was not asked to take rest. Actually, his troponin level was 386. Usually, cardiologists don't ask for much rest and all after this stenting because it's a very light procedure, everyone is saying. But his problem, his heart is not functioning, the damage is there. So, in clinically supported lifestyle correction, especially when the troponin level is high, till the patient is stable without medicine, especially for the hypertension and this troponin level is no, and the other clinical markers. This HSCRP, so HSCRP is 54, ESR 70, CRP is 52. And his GFR is very low because of this stent insertion, this contrast nephropathy. He's in the stage 3 renal failure actually. So microalbumin is also present. So many problems are there. Then what happened? What was the change with the clinically supported lifestyle correction? Okay, this diabetes, HbA1c came down to 6.8 by the 6.7 by the second week itself, and by 6.3, and then 5.8 and 5.7. 5.1. By 30th day, 60th day, his HbA1c will come to 5.5 without any medication. That is after stopping all this, and all his blood parameters has come down, improved, and his troponin level by the 10th day, 15th day, it is came down to normal, and GFR increased to 94 by the 60th day. So almost all the medicines were over by the first month itself, before the 30th day, and all the blood parameters came down to normal by 60th day. So not all the medicines actually, he has to continue his aspirin and the blood thinners and the anti-acidity medicine for at least for the 1 year. One more patient. This is a 61-year-old lady, and her height is 151 centimeters and weight is 58.4. She has been diagnosed, she is diabetic, hypertensive, and diagnosed with the triple vessel disease 14 years back actually. She was advised to have diagnosed with the cardiovascular disease 14 years back, and angiogram, triple vessel disease, and advised surgery, but she was very afraid and didn't do the surgery. But instead she gone for this chelation therapy, and she was continuing with the chelation therapy. But now she is finding it very difficult with the ordinary work. Even she is not able to take a bath, or with the defecation. This bowel movements itself is making her painful, and the chest discomfort is there. And when she was taking so many medicines for the diabetes, hypertension, and cholesterol, and even she is on because of this tension, she is taking antipsychotic medicine also. I'm not going into the details of the medication. And her on checking, the detailed checkup will be done, and her vitamin D was so low, 9.5 only, and HbA1c was 7.6. and troponin level is 495. That is, she's having muscular damage, attacks is there. And this iron level are so many. I'm not going into the details. And the most important here you have to look into is the troponin level is high, and also CA, that is a cancer marker. CA is a colon cancer, carcinoembryonic antigen. It is having a pre-cancerous condition also. And then what happened with this after the clinically supported lifestyle correction? And the diabetic medicine we stopped on the first stage itself because her it's a type 2 diabetes, her insulin and pancreas is working properly. And with the by the 15th day itself, your SbA1c came down to 6.3, and the first day within 24, usually within 24 hours, blood sugar will come to normal. Only if they take take food out of the way, only the sugar will increase under the clinically supported lifestyle correction. And by the day 90, her SbA1c has come to 5.5, and all the medicines was over by 30th day. In between, if she is getting, because of which is the nature of the stress also, if she is advised to take this Corbis bisoprolol, that is a beta blocker, if she is having palpitation or BP is high. Otherwise, she need not take, and if she is feeling any chest pain, she is asked to take the sublingual tablets, especially as a prophylactic if she is going for taking bath or defecation. If you for the first month she is on cardiac medication itself, and that time also if there any pain she can put, but she was taking in between, she was needing this sublingual tablet. By the second month also she was occasionally using, and by the third month she has come out of without any discomfort. She is able to manage without even sublingual tablets. And this troponin level actually it is come down to 139, 495 to 139 in the 8th day, 24 in the 15th day, and 21 in the 30th day, and normal by 6 by the 30th, 60th day. And also this precancerous situation, the CEA also came down to normal by the, actually by CEA is almost normal by 60th day 2.5, and finally by the 90th day it is 1.5. So she has come out of so many months and years she was suffering, and now she is able to come out of all her problems, actually diabetes, hypertension, and even precancerous situation. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by plant exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, cancer, liver disease, kidney disease, obesity, stroke, allergies, autoimmune disease, etc. comes under the umbrella of lifestyle diseases. 90% of the medication and 90% of the surgeries are of lifestyle disease. This means that 90% of the medicines and 90% of surgeries can be avoided. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication nor surgery that created the disease. This is why once medication is started, very often both the disease and medicines will keep on adding more numbers along with the unwanted side effects. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approach, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch and completed diploma and MD in Obstetrics and Gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine and surgery, joined government service, later resigned from government service, and in 1997 started practicing as consultant at Life Care Center, Tevara, Kochi, focusing on lifestyle modulation with the clinical support for lifestyle diseases, minimizing the need for medication and surgery. Another important thing every patient should understand is a patient's role in drug pollution. Major part of the medications we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us humans but also all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle disease and come out of medications to protect our children, grandchildren and the coming generations from the ill effect of toxic pharmaceutical pollution. We should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on reversing lifestyle diseases and minimizing medication is the need of the hour. Therefore, remember to share this to your relatives, friends and colleagues who are on chronic medication or planning surgery for lifestyle disease. The last few decades of modern medical management clearly shows that medication and surgery cannot cure most lifestyle diseases. Reliable and sustainable solution lies in lifestyle modulation. To know more about different lifestyle diseases, treatment options, reversal of lifestyle diseases with clinically supported lifestyle modulation, etc., you may visit our healthcare channel. Thank you.